Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, James. Dr. Morrison, the neurologist, forwarded your information, but I'd like you to tell me about your symptoms and why you felt the need to seek a consultation.
Hi, doctor. For the past few months, I've been experiencing balance issues, especially when I walk. It started off as a minor problem where I'd occasionally lose my balance, but it's become more frequent now. About 3 weeks ago, my daughter noticed that my speech was a bit slurred, almost like I'd had a drink, which I hadn't. Additionally, I sometimes feel this odd tingling sensation in my fingers. Initially, I brushed it off, thinking it might be due to tiredness. But it's become hard for me to ignore now, especially when I find it challenging to write or grip objects.
I see. It's essential to address any change in neurological functions. How has this affected your day-to-day life?
Immensely. I'm a teacher, and I find it challenging to write on the board or maintain my balance while walking around the classroom. My students have noticed it too. It's become a cause for concern, and I'm worried it might be something serious.
Understandably, this must be concerning for you. Do you have a family history of any neurological disorders or any other chronic conditions?
My grandmother was diagnosed with something called Friedreich's ataxia when she was in her 40s. I've heard my family talk about it, but I never really knew what it was. As for other conditions, my mother has diabetes and my father had hypertension.
Friedreich's ataxia is a hereditary condition that affects the nervous system. Given your symptoms and family history, it might be something we need to consider, although we'll run tests to rule out other possibilities. Are you experiencing any pain or muscle weakness?
No pain as such, but I do feel like my legs tire out faster than before, especially when climbing stairs.
All right, James, we'll need to run a series of tests, including an MRI, nerve conduction studies, and maybe a genetic test to understand what's going on. But I want you to know, regardless of the diagnosis, we have therapies and interventions that can help manage and improve the symptoms.
That's reassuring, doctor. I just want to be able to get back to my normal life and continue teaching without these challenges.
I understand, and we'll do everything in our power to help you. We'll take it one step at a time, and together we'll navigate through this.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, how can I assist you today?
Hi, I've noticed this lump on my arm that's been growing slightly over the past few months. My friend mentioned it might be a lipoma, so I thought I'd get it checked out.
I see. Lipomas are common and usually harmless, but it's good that you came in to have it evaluated. Can you tell me more about when you first noticed it and any changes since then?
I think I first saw it around 6 months ago. It was smaller then, and now it seems like it's getting a bit bigger. It doesn't hurt, but sometimes when I press on it, it feels a bit tender.
All right, do lipomas run in your family? Sometimes there's a genetic component.
I'm not sure, but I think my aunt had one removed a few years ago.
Okay, are you experiencing any numbness, tingling, or pain radiating from the lump?
No, not really, just that tenderness I mentioned.
Understood. I'd like to take a look and feel the lump. Is that all right?
Of course.
Based on the location, consistency, and your description, it does sound like a lipoma. They're benign fatty tumors that grow between the skin and the muscle layer. However, to be certain, I would recommend getting an ultrasound or possibly a biopsy.
Is it necessary to remove it?
Lipomas don't usually require removal unless they're causing discomfort or you're concerned about cosmetics. If it grows rapidly, becomes painful, or changes in any way, we would consider excising it. Also, if you're anxious about it, that's a valid reason too.
What does the removal process involve?
It's a relatively simple outpatient procedure. We make a small incision, remove the lipoma, and then suture the incision closed. The recovery time is typically short.
Will it leave a scar?
There might be a small scar, but we try to make the incision as inconspicuous as possible. Over time, scars tend to fade, and there are treatments available if you're concerned about its appearance.
I'm a bit worried about the costs. Is the removal typically covered by insurance?
Most insurance companies cover the procedure, especially if there's a medical reason for the removal. It would be best to check with your provider to be sure.
Thank you for explaining everything. I'll think about whether I want it removed or not.
You're welcome. Remember, there's no rush. But if you notice any changes or have any concerns, don't hesitate to reach out.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Excuse me, Nurse Thompson. I have a couple of questions about the physical therapy regimen for my post-op knee surgery.
Of course, Mr. Lawrence. I have your rehab protocol right here. It's under the tab labeled Therapy Protocols. Please ensure it matches your given instructions.
All right, first off, the patient's name is Robert Lawrence. That's me.
Robert Lawrence, got it. And for our records, can you confirm your date of birth?
12/15/56, December 15, 1956.
Correct. Now, do you have any allergies we should know about, especially related to pain medications or therapy creams?
I have a latex allergy.
Noted, latex allergy. Okay, looking at the rehab exercises, it says gentle knee extensions, 15 reps twice a day, seated leg curls, 10 reps 3 times a day, and stationary cycling 10 minutes once a day. Does that match your instruction sheet?
Yes, that sounds right.
Great. For pain management, your physician has prescribed ibuprofen 400 milligrams PO twice a day. Ensure to take this with food. And you also have a PRN order of Tylenol 500 milligrams for pain exceeding 5 on the scale of 10. Does that make sense?
Yes, I'll take those as needed.
Fantastic. Please make sure all these orders have a recent date, time, and your surgeon's signature. Once you've verified everything, please acknowledge with your initials on the therapy protocol sheet.
Will do. Thanks for clarifying.
Now look at question 26.
Hi, I'm Lucas Green. I spoke with Dr. Patel earlier about my father's post-stroke care and modifications to his home.
Yes, Mr. Green. I have the recommendations and equipment list right here. They were just prepared.
Great.
Firstly, we recommend installing grab bars in all the bathrooms and main areas to help with mobility and safety.
I've already ordered some. They'll be installed by the weekend.
Excellent. We also advise a raised toilet seat and a shower chair. It's crucial for his safety, especially in the initial weeks post-discharge.
Got it? Anything else?
A non-slip mat for the shower and ensure that all walking paths are clear of any tripping hazards. It's crucial to prevent falls at home.
I'll make those changes. Oh, what about his medication? He used to take them with breakfast. Is that still okay?
Yes, but considering the new medication for blood thinning, it's best to have a consistent meal with it, preferably lunch.
Okay, lunchtime then. And the speech therapy, when does that begin?
We've scheduled his first session for next Tuesday. It's essential for his cognitive recovery.
Perfect. I appreciate all the guidance.
Anytime, Mr. Green. We're here to help.
Now look at question 27.
When I brought up the topic of holistic medicine in a medical conference, I was met with a lot of skepticism. A senior cardiologist there said there's no evidence that holistic approaches have any scientific basis.
Oh, I've heard that argument before. And my reply to them has always been that they're right in the context of their own experiences and training.
That's an interesting way to put it.
Yes, because if they haven't been introduced to it, or if they haven't seen the evidence firsthand, their perspective remains limited. But that doesn't negate the experiences of others. If holistic practices aren't represented in the mainstream medical literature they're familiar with, it's harder for them to understand or appreciate its value. We need to bridge that gap, show the results, and create a dialogue.
Right. It's all about exposure and education, and getting the right information in front of the right people.
Now look at question 28.
Early in my career as a respiratory therapist, I had this overarching fear that I might harm a patient by accident due to lack of experience or oversight.
It's a fear many of us in healthcare have felt at some point.
Exactly. And that fear was paralyzing. Instead of driving me to be better, it made me hesitant in my actions. But then I learned a crucial lesson.
Which was?
Instead of suppressing that fear, I should channel it. Whenever that fear surfaced, I would ask myself, how can I use this emotion to become more diligent, more attentive, and ensure patient safety? I had an incident early on where I miscalibrated a ventilator. It was a simple oversight, but it could have been dangerous.
That must have been tough to handle.
Indeed. But when I realized my error, I immediately reported it. I also went to my senior and explained the situation. It was a challenging conversation, but she appreciated my honesty. From that experience, I learned that it's not about being flawless, but about how you respond to mistakes. Whenever doubt creeps in now, I remind myself, from every experience, I can learn, adapt, and grow to serve my patients better.
Now look at question 29.
Let's review Mrs. Ella Williams. She's a 58-year-old female who recently had a slip and fall incident in her garden. She was brought into the ER at around 1700 hours on the 5th of September with a displaced hip fracture.
Displaced? Could you clarify that term for me?
Certainly. Displaced means the broken pieces of bone are no longer aligned in their normal position.
Got it. Continue, please.
She underwent a hip replacement procedure. She also suffered a sprained wrist and has a contusion on her forehead. On her left leg, she has a minor abrasion that's been cleaned and dressed.
So a replacement for the hip and a contusion on her head.
Exactly. The dressing for the abrasion was last changed at 0800 hours today. She's been prescribed ibuprofen for pain and inflammation, and she's on a calcium supplement to support her bone health.
Now look at question 30.
I worked closely with a woman named Lucy, an alias, of course. She frequently reported seeing shadows and held a strong belief that they were trying to communicate with her. Upon her admission to our facility, our primary goal was to make her feel understood and not isolated due to these unique experiences.
That sounds quite challenging.
It was, but art became a bridge for us. Through drawing and painting, she found a way to express these perceptions. Not only did it serve as a therapeutic outlet, but it also helped our team gain insight into her world.
Art therapy can be powerful.
Indeed. Through consistent engagement and our combined efforts, Lucy began to feel more grounded and connected. She gradually learned coping mechanisms to manage her stress and anxiety. Without the therapeutic approaches we employed, she might still be struggling, feeling trapped in her own perceptions.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today, we're joined by Dr. Maya Anderson, an oncologist and leading cancer researcher based in the UK. Dr. Anderson, can you give our listeners a broad overview of cancer and its global impact?
Cancer is a term used to describe diseases in which abnormal cells divide uncontrollably and can invade other tissues in the body. It's not just one disease, but many diseases, with over 200 different types. These malignant cells can spread through the bloodstream and lymphatic system. Globally, cancer is a leading cause of death, with approximately 18 million new cases and 9.6 million deaths in 2018 alone. Sadly, its prevalence is often due to a combination of genetic factors, environmental exposures, and certain behaviors.
That's concerning. With such a vast range of types, how do we even begin to approach treatment?
It's true that the variety of cancer types does pose a challenge. However, the primary treatments for cancer include surgery, radiation therapy, chemotherapy, targeted therapies, and immunotherapy. The choice of treatment usually depends on the type, stage, and location of the cancer, as well as the patient's overall health. Advancements in personalized medicine are also enabling us to tailor treatments to the genetic makeup of individual tumors, increasing the likelihood of successful outcomes.
Are there any breakthroughs or recent developments in the world of cancer research that the public should be aware of?
Yes, there's a lot of exciting progress. One of the most notable is immunotherapy, which harnesses the body's immune system to fight cancer cells. CAR T-cell therapy, for instance, involves altering a patient's own T-cells in a laboratory to make them more effective in targeting and killing cancer cells. Additionally, liquid biopsies are emerging as a non-invasive method to detect cancer at an early stage by analyzing tumor DNA in the bloodstream.
Can you share a personal experience with a patient that highlights the challenges and hopes in cancer treatment?
Certainly. I had a patient, let's call her Sophie, who was diagnosed with a rare form of lung cancer at just 32. She never smoked and lived a healthy lifestyle. Understandably, she was devastated. Genetic testing revealed her cancer was driven by a specific mutation. Fortunately, there was a targeted therapy available for her mutation. Sophie has been on this therapy for over 3 years now, and her tumors have shrunk dramatically. Stories like Sophie's give us hope and underline the importance of research and early detection.
What are the preventive measures one can take against cancer?
Some factors are out of our control, like genetics. However, there are lifestyle choices that can significantly reduce one's risk. These include not smoking, maintaining a healthy diet rich in fruits and vegetables, exercising regularly, and protecting oneself from harmful UV rays. Regular screenings and self-examinations for certain cancers can also lead to early detection, which often means better outcomes.
Lastly, what's the future for cancer treatment?
The future is promising. We're moving towards more precision medicine, where treatments are tailored to individual patients. The integration of AI and machine learning in research is helping us understand cancer at a molecular level and develop better therapies. Moreover, global collaboration among researchers and institutions is accelerating the pace of discovery. While challenges remain, there's genuine optimism in the oncology community.
Thank you, Dr. Anderson, for enlightening us today.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone. My name is Dr. Emily Foster, and I specialize in respiratory medicine. Today, I'd like to discuss a common but often misunderstood condition called asthma. By the end of our chat, I hope to shed light on what asthma is, its implications, and how we as healthcare professionals approach its management. Firstly, what exactly is asthma? At its core, asthma is a chronic inflammatory disorder of the airways. In simpler terms, it means that the tubes that carry air in and out of the lungs are prone to inflammation and can constrict easily, leading to difficulty in breathing. This is typically manifested as wheezing, shortness of breath, chest tightness, and coughing. Factors like allergens, cold air, exercise, or even stress can trigger these symptoms. Picture this scenario. Sarah, a 9-year-old girl who loves playing outdoors, suddenly finds herself gasping for air after playing in a garden on a spring day. Pollens, which are high during this season, act as allergens for her. Her airways respond by swelling up and producing mucus, making it hard for her to breathe. That's an asthma attack. The challenges in managing asthma are multifold. Firstly, it's a spectrum. While some may have an occasional flare-up, others might deal with severe and persistent symptoms that can drastically impair daily life. Moreover, there's often a misconception that asthma is just a childhood disease. While it's true that it often starts in childhood, it affects people of all ages. When I approach an asthmatic patient, my first goal is always to understand the severity and triggers of their condition. For Sarah, it might be pollens. For others, it could be dust, smoke, or even strong fragrances. The backbone of asthma treatment is controlling the inflammation. Inhalers, often termed as puffers, are the most common tool. These deliver medicine directly to the lungs. The blue inhaler, which many might recognize, provides quick relief during an attack. But there are also preventive inhalers, often brown or orange, that help keep the inflammation at bay. One of the critical aspects of managing asthma is patient education. It's not enough to hand someone an inhaler and send them on their way. Patients need to recognize their triggers, understand how to use their medications properly, and most importantly, when to seek emergency care. It's like teaching someone to read the weather. The more they understand their body's responses, the better equipped they are to navigate through life without being held back by their condition. Let's return to Sarah. After recognizing pollens as a trigger, she now uses a preventive inhaler during the spring season, avoids playing outside on particularly high pollen count days, and always keeps her relief inhaler handy. She also has an asthma action plan in place, developed in conjunction with her pediatrician. This plan has empowered Sarah and her parents, ensuring that she enjoys her childhood without fear. Asthma, although common, is a nuanced condition with a broad spectrum of presentations. As healthcare professionals, our aim isn't just to treat the symptoms, but to equip our patients with the knowledge and tools they need to lead full, active lives. And every time a patient like Sarah goes back to doing what they love without fear, it reminds me of the profound impact we can make in their lives.